Click forward. Good afternoon. This is Dr. Bhupesh from Dr. BKM Institutes, and wish you all the luck for all the people who are having exam tomorrow. So again, we are taking one of the topics from authentic OET itself, that is from the Cambridge Boxell. So again, the topic is about a 3-year-old child has been brought to the hospital suffering from the chest tightness, wheezing, and dyspnea. You suspect that the child has asthma. The patient is anxious and becomes agitated while the child is waiting to see a doctor. I think it should be parent. The parent is anxious. Yeah, that's what I was wondering. So basically what is happening that today's topic is a different topic where you are not talking directly to the patient, because patient is a child, just 3-year-old. So you're talking to the parent. So it's a third party task. That's what I normally say. And in this question becomes little tricky. Why? Because in a normal speaking, if I say, what do you eat? So I normally say, what do you eat? That's easy. But when it comes to third party task, I'm asking about his son or daughter. So I will say, what does he eat? So this does has got special marks. So that is why asking questions become a bit of a trick when it comes to the third party. So this does is very important. So that is why I will always write, if something like this comes in the exam, I would always write in the bracket does. I'm saying everything needs to be written, question mark. That is how I will make myself और give myself a reminder कि मुझे does ही बोलना है. So 3-year-old child है जिसको asthma हुआ है, chest tightness है, wheeziness है, dyspnea है. Parent anxious है और agitated है, लेके to waiting to see a doctor. You are the nurse taking the child's vital signs. So मतलब तब तक आप vital sign ले रहे हो और डॉक्टर अभी तक आया नहीं है, तो आपको पता है पेरेंट को तो एंजाइटी होगी. So basically this is an anxiety management task. आपको एंजाइटी मैनेज करनी है पेशेंट की. तो पेशेंट की एंजाइटी देखते हैं क्या है. एक्सप्लेन टू द पेरेंट दैट इमरजेंसी डिपार्टमेंट हैज बीन बिजी एंड एज सून एज द डॉक्टर बिकम्स अवेलेबल ही शी विल बी ओवर टू सी योर चाइल्ड. तो आपको सबसे पहले ये कहना है, आई एम सॉरी टू से बट एट दिस मोमेंट. इतना सही तो बोलना होता है. देखो कितना अच्छा बना सकते हैं. सिंपल. देखिए फर्स्ट पॉइंट, आई एम सॉरी टू से, बाकी सब सेम. आई एम सॉरी टू से that today doctor has been busy because he has been attending patient in the emergency ward, and today the patients are comparatively more, so doctor will be coming soon as he becomes available. So at this point of time you need to wait for the doctor for some minutes. Ask the parent to briefly explain her child's condition. तो वो बताएगा कि I can't tell you now, it's like it's really difficult, he's having chest tightness, dyspnea, like he's having chest tightness and he's unable to breathe. So that is how he would say. So he will say, explain what the doctor will do. So doctor जब आएगा वो diagnosis करेगा medical assessment के बाद. Reassure the parent that you are doing everything possible to take care of your child who is stable. तो at this moment your child is stable. तो ये line सबसे important है. अब इस line को आपको थोड़ा पहले बोलना चाहिए. See, your child is stable, there is nothing to worry. There is nothing to worry. ये लाइन आपको आनी चाहिए हमेशा. ये बहुत टास्क में काम आती है. There is nothing to worry, your child is stable या you are stable, so there is nothing to worry. जब भी पेशेंट ओवर एंशियस होता है तो आपको इस लाइन का यूज करना होता है. Encourage the parent to relax and to allow you to attend the child. उसको आप रिलैक्स करो, मेरे को चाइल्ड को अटेंड करना है, मेरे लिए बहुत जरूरी है. Explain that you need to continue taking the child's vital signs. कि वो कहेगा vital sign लेके टाइम वेस्ट क्यों कर रहे हो, तो आप बताओगे these vital signs are very important. क्योंकि वाइटल साइंस ही तो डॉक्टर को हम बताएंगे. वाइटल साइंस आर इम्पोर्टेंट. अगर आप अच्छा वर्ड बोलना चाहते हो तो एक पैसिव वॉइस यहाँ पे बना सकते हो. वाइटल साइंस आर इम्पोर्टेंट टू बी रिकॉर्डेड एज ओनली आफ्टर दैट. उसके बाद ही डॉक्टर विल बी एबल टू मेक द राइट डायग्नोसिस. ये लाइन आपको, मुश्किल लाइंस आपको लिखनी है टॉपिक में. मैं आपको लिख के, ये नहीं कि आपको सिखाने के लिए लिखता हूँ, आपको भी पेपर में लिखनी है ऐसी जो कंपैरेटिवली डिफिकल्ट लाइंस हैं. सो ये आपका लास्ट पॉइंट है, क्योंकि इस पे पेशेंट आपको बोलेगा आप मेरा टाइम वेस्ट क्यों कर रहे हो, तो आपको बताना है हम टाइम वेस्ट नहीं कर रहे. दीज वाइटल साइंस आर इंपॉर्टेंट टू बी रिकॉर्डेड, क्योंकि इसके बाद ही डॉक्टर विल बी एबल टू मेक द राइट डायग्नोसिस. आज मैं आपको ये भी दिखा रहा हूँ कि अगर ये पेपर में टास्क आता है तो आपके जो सामने पेशेंट बैठा है, सो कॉल्ड एग्जामिनर, उसको क्या टास्क मिलता है. उसको टास्क मिलता है, योर 3-year-old चाइल्ड हैज बीन ब्रॉट टू द हॉस्पिटल सफरिंग फ्रॉम चेस्ट पेन. सो आपके पास बेसिकली एक 3-year-old चाइल्ड आया है and he has come for this thing. Your 3-year-old child has been brought to the hospital suffering from the chest tightness, wheezing and difficulty breathing. You are extremely anxious as you fear your child has asthma. तो पेरेंट, आपको पेरेंट का रोल प्ले करना है कि मेरे बच्चे को एस्मा हो रखा है. You have been waiting to see a doctor. A nurse is asking you questions about your child and you become agitated as you want to see a doctor. तो आप obviously आपका child परेशान है तो आप कहोगे कि मतलब मैं आपके क्वेश्चन का आंसर क्यों कर रहा हूँ, मेरे को ये बताओ डॉक्टर का है, मुझे डॉक्टर चाहिए. तो कंप्लेन टू द नर्स दैट यू हैव बीन वेटिंग फॉर पास्ट आवर, 1 घंटा हो गया मुझे बैठे हुए, क्या चल रहा है. तो आपको यही पूछना है. तो पेरेंट ऐसे कहेगा, ब्रीफली एक्सप्लेन योर चाइल्ड्स कंडीशन एंड दैट यू आर कंसर्न्ड अबाउट योर चाइल्ड. डिमांड द नर्स, तो उसको बताना है कि भाई एस्मा की, वो कहेगा कि एस्मा है, आपको कहना है कि एस्मा नहीं है, आपको अपने आप डायग्नोसिस नहीं करना चाहिए. डिमांड द नर्स टू टेल यू दैट इफ योर चाइल्ड इज सफरिंग फ्रॉम अस्थमा, तो जान के वो बार बार पुश करेगा आपको, माई चाइल्ड इज हैविंग अस्थमा, माई चाइल्ड इज हैविंग अस्थमा. आपको नहीं कहना है कि एस्मा है, क्योंकि आपको टॉपिक में दे रखा है कि डॉक्टर विल कम एंड ही विल मेक द मेडिकल डायग्नोसिस आफ्टर द मेडिकल असेसमेंट. प्लीज आप अपने आप मत करो. सो ये बहुत इंपॉर्टेंट पॉइंट है. डू नॉट मेक सेल्फ डायग्नोसिस प्लीज, इट इज नॉट गुड. एजिटेटेडली टेल द नर्स यू वांट द डॉक्टर टू सी योर चाइल्ड इमीडिएटली. वो दोबारा कहेगा मेरे को तो चाइल्ड ही चाहिए, डॉक्टर ही चाहिए. रिलक्टेंटली अग्री टू अलाउ द नर्स टू ऑब्जर्व द चाइल्ड. तो उसको ये टास्क मिला है, यानी उसको टास्क ही आज ये मिला है कि वो आपको तंग करेगा. आप समझ रहे हो. तो कभी भी एग्जामिनर आपको तंग जान के नहीं करता, उनको टास्क मिलता है. तो इससे आपकी न्यूट्रल फीलिंग्स हो जाएंगी. अगेन जब आप कह रहे हो, तो अगेन फर्स्ट पॉइंट मैंने आपको कहा है, चाहे आप कितने ही इंटेलिजेंट हो, आपको फर्स्ट हमेशा लिखना है, गुड मॉर्निंग, माय नेम इज भूपेश and I am a nurse over here. So I am here to examine your child. So I am here to examine your child. तभी तो vitals होंगे. या फिर आप ऐसा भी कह सकते हो, how may I help you today. आप ऐसा भी बोल सकते हो, कोई दिक्कत नहीं है उसमें भी, how may I help you today, depending upon the task. So एक बार दोबारा पढ़ लेते हैं. हमारा टास्क क्या था, एक्सप्लेन टू द पेरेंट इमरजेंसी डिपार्टमेंट. तो वो डॉक्टर के लिए, ठीक है. अब मैं आपको टास्क करके दिखाता हूँ. Good morning, my name is Bhupesh. I'm a nurse over here. So how may I help you? Well, nurse, see, I'm here for my kid. He is having asthma and I'm really worried about him. If you don't mind, is your child already diagnosed with asthma? Well, no, nurse, he has not been, diagnosed with asthma, but he's having chest tightness. He's having problem in breathing. So when I read the internet, I came to know that it can be asthma. See, first of all, I would like to tell you, you should not diagnose any disease by yourself. It is not right to do so because it can be anything. So please understand, it can be a very temporary condition. You should not diagnose your child. But nurse, what can I do? Being a parent, I am very anxious. I want to see a doctor and it has been 1 hour that I have been waiting for the doctor. Where is the doctor? Well, I'm sorry, but doctor has been a little busier today because the emergency department has been very busy. And as soon as the doctor becomes available, he will come over to see your child. We have already informed the doctor. But nurse, what kind of a hospital is this? My child is unstable and you guys are not providing the services. I'm disheartened. Well, don't get disheartened. That is why I am here. So I'm here to observe your child and also to collect the vital signs. First of all, after, so may I examine your child? Yes. Okay. So after examination, I have found that your child is stable and I am doing everything possible to take care of your child and he is stable at the moment. So there is nothing to worry. And doctor will attend your child shortly. But nurse, why don't you understand he is having asthma? Well, I have already told you, it is not right to make a kind of self-diagnosis because only doctor is the authorized person to make the diagnosis. So to provide a diagnosis, he will require a thorough medical assessment. That is why I am collecting the vital signs. I will give these vital signs to the doctors. These vital signs are very important to be recorded, as only after that doctor will be able to make the right diagnosis. So please understand, we are not wasting your time. We are just following the medical protocol. जब भी ऐसा टास्क आता है, ये वर्ड बहुत इंपॉर्टेंट है. We are just following the medical protocol. So only doctor is the authorized person. Protocol, and only doctor is the right person. Doctor is authorized person to make diagnosis. So I will again encourage, please do not diagnose your child. Okay, nurse, but what can I do now? You just need to relax because now we are here and we are nurses, we are medical professionals. So we are taking care of your child and please let us attend your child in a better way, and I need to record the vital signs. So it is very important for me to continue monitoring the vital signs of your child. All right, nurse. Okay, then you do whatever you want, but I don't know what should I do. Well, again, I understand that being a parent, you are anxious, and obviously, if I would have been at your place, I would have been anxious as well. तो ये would have been होते हैं, would have been probability के लिए होते हैं. If I would have been at your place, if I would have been at your place, I would have been anxious as well. ये दो बार होगा. Would have been का मतलब मैं भी होता है. ये probability के लिए होते हैं, सोचने के लिए होते हैं कि अगर ऐसा होता तो ऐसा होता. If I have been, I would have been at your place, I would have been anxious too. So there is nothing wrong. It's just about, I understand that being a parent, you are concerned and you are worried, but we have already informed the doctor, so there is nothing to worry. Okay, nurse, then do whatever you want. Okay, then don't worry. I'm just recording the vital signs, and I reassure you that your child is stable at the moment and there is nothing to worry. तो इस task में भी आप reassure कर सकते हो that there is nothing to worry. He's stable and I am recording his vital signs. So एक बार मैं दोबारा बोल के दिखा देता हूँ क्योंकि थोड़े fumbles हुए हैं क्योंकि task नया था. Good morning. My name is Bhupesh and I'm a nurse over here. So how may I help you? Well, nurse, I'm here for my kid. So could you please tell me what happened to your kid? Oh, well, nurse, he's just having kind of asthmatic symptoms. He's unable to breathe, having chest tightness. So I read over the internet. I came to know that it can be asthma. Well, first of all, I'm really sorry to say, but it is not right to diagnose your child. Doctor is the only authorized person who is allowed to make the diagnosis, and that too after the thorough medical assessment. So please do not diagnose your child. All right, I understand, nurse, but I'm really worried. He's having kind of problems. He's unable to breathe even. Well, okay, let me examine your child. After examination, I have found that his condition is stable. So please don't worry. And also we will do everything possible to take care of your child in the best possible way. So please don't care. Okay, nurse, but I think it is asthma only. Well, I would again like to repeat that please do not diagnose your child yourself. It can be really bad. So please understand that only doctor is the right person who can make the diagnosis. So please understand. But where is doctor, nurse? I have been waiting for doctor for such a long time. Where is he? Well, I would like to tell you that today emergency department has been busy and we have already informed the doctor. So doctor would be on his way and he is coming to your child very soon. But nurse, I have been waiting for 1 hour and you are saying emergency department is busy. Like what kind of hospital is this? Even my child needs emergency treatment and you are wasting my child's precious time. Well, no, I'm sorry to say, but as I have already told you that your child is stable and there is nothing to worry. We are doing everything possible to take care of your child in the best possible way. So please relax and calm down and have a seat, and please allow me to attend your child and to record his vitals. Nurse, but why are you passing time with my child? Why do you need to record the vitals? See, vitals are very important to be recorded because only after that doctor will be able to make the right diagnosis. So doctor will ask for these vitals. So we are just following the medical protocol, and after that doctor will make the diagnosis for your child. Oh, well, nurse, I'm not understanding anything. Please help me. Please see, I understand. If I would have been at your place, I would have been anxious too, because being a parent is a very, very serious job. Obviously, I understand. So you might be worried, but please don't worry. We all are here to help your child. Is it all good? Can I record the vitals? Yes, nurse. Okay, you can do whatever you want, but take care of my child. Of course, we are taking care of your child. And now I'm recording the vitals. And again, I would like to reassure you that he is stable and doctor is on his way. He would be coming to your child very soon. Is it all right? Okay, nurse. Okay, so I'm recording the vitals. That is how you execute the role play, and that is how it goes. Again, listening to it 2-3 times will make you very, very apt and very, very strong. Again, मतलब मैं 3-4 तरीके से बोलता हूँ, हर बार लाइन इधर से उधर जाती है, तो वो इसलिए होता है बिकॉज मैं नेचुरली बोलना चाहता हूँ. तो अगेन लॉजिक वही है. डेप्थ में अगर हम प्रोफाउंड डिस्कशन करें तो मेन बात यही है कि आपको इंग्लिश की प्रैक्टिस बहुत ज्यादा करनी चाहिए. रेस्ट एवरीथिंग विल हैपन बाय इटसेल्फ. एवरीथिंग विल फॉल इनटू प्लेस इफ यू विल प्रैक्टिस हार्ड. एक स्पीकिंग को एक बार नहीं, 4 बार 5 बार सुनो. अगर आप नए स्टूडेंट्स हो तो चारों मॉड्यूल्स को इकट्ठा मत उठाओ, पहले स्पीकिंग पे जोर लगाओ. 5-6 बार एक स्पीकिंग को सुनो. 2-3 दिनों में आपको स्पीकिंग अच्छी लगेगी. जैसे ही कॉन्फिडेंस बढ़ेगा आप बाकी मॉड्यूल्स बड़े इजीली कर पाओगे. So that is what is the way of doing OET. स्पीकिंग के साथ साथ थोड़ा राइटिंग करो। राइटिंग और स्पीकिंग पे पूरा जोर लगा दो, पहले हफ्ते में पूरा जोर। रीडिंग और लिसनिंग चाहे थोड़ी थोड़ी कर लो, घबराओ मत। बस एक बार फर्स्ट वीक में अगर राइटिंग और स्पीकिंग पूरी तरीके से समझ आ गई तो बाकी 2 मॉड्यूल्स आसानी से हो जाएंगे। So this is Dr. Bhupesh from Dr. BKM Institutes. Our contact number is 76967342256. Thank you.